Hello, and welcome to today's presentation. I would now like to introduce your speakers for today. Rachel Greil, HR Consultant, Employee Wellbeing, Cincinnati Children's Hospital, and Chris Mosnick, Chief Clinical Officer, CALM. Chris, you have the floor.
Thanks, Catherine. So let me go over today's agenda. In today's session, I'm going to start by explaining why we need a holistic approach to physical and mental health. Next, I'll take you through our Healthy Mind workplace model for whole health, including our 5 pillars of prevention. Then Rachel, she's going to share how Cincinnati Children's Hospital is providing a preventative approach to mental health. And then she'll discuss how Cincinnati Children's partnership with CALM is helping employees have better outcomes. And then finally, we'll have a few minutes for Q&A. So next slide, please. But before we do that, let's center ourselves with a 1-minute meditation.
Hey there, my name's Chibs Okereke. I know, you're too busy to meditate. But this is a mini meditation, just 60 seconds to unplug and reboot when you're feeling fried. Let's get straight into it. Eyes open or eyes closed. Start by settling your focus on the breath. Noticing the inhale and the exhale. For the next 3 breaths, we're going to lengthen our exhale and engage our relaxation response, keeping the body relaxed as we breathe in, 2, 3, breathe out, 2, 3, 4, 5, 6. Do a couple more breaths on your own. Now allowing our breathing to return to its natural rhythm. We all have those frantic moments where you feel too busy for a breather. That's often when we need it most. Remember, it only takes a minute to take 3 controlled breaths and give yourself a break. 1 last breath in, and a slow breath out. Now let's get back to our day.
Stupendous. That was a great way to kick off the webinar. So let's get started. And first, I'd like to share a little bit about CALM in case you aren't familiar with us. So we have more than 110 million app downloads and more than 2,500 customers. So CALM is the #1 most downloaded app for meditation and mindfulness. We offer a proactive approach to members' health and wellness that leads to less stress and less urgent mental health issues in the future. In CALM, we stand out from the traditional EAP or corporate benefit because our resources, they're designed to support the broad spectrum of needs across your population. Next slide, please. We're working with over 3,000 companies around the world, partnering with them on their biggest mental health needs in the workplace. And we're very excited to partner with Cincinnati Children's Hospital, who you'll hear from shortly. Next slide, please. Now I want to explain a little bit more about the scientific link between our physical and mental health. Next slide, please. So our physical health is closely tied to mental well-being. In fact, mental health is an underlying factor of comorbidity in many physical diseases. For example, people with depression are at a higher risk for diabetes, stroke, cardiovascular disease, and other diseases. Another example is emotional stress, which is a major contributing factor to the 6 leading causes of death in the U.S. Cancer, coronary heart disease, accidental injuries, respiratory disorders, cirrhosis of the liver, and suicide. Next slide, please. One of the most prominent examples of the mind-body connection is how chronic stress leads to chronic physical conditions. In short, stress increases the production of hormones such as cortisol and adrenaline. Stress is great for short-term problems like avoiding getting eaten by a bear, but chronic stress leads to our stress hormones being chronically elevated, which is very bad. Those stress hormones increase the risk of weight gain, high blood pressure, stroke, and other physical symptoms. But worst of all in my book, sleep problems. Next slide, please. So it's probably no surprise that mental health conditions can also come with increased healthcare expenditures. For example, people with depression are 2 to 4 times more likely to have an increased level of medical spend compared to people without depression. And people with comorbid diabetes and depression, they have a likelihood for increased likelihood for inpatient hospitalization, more outpatient visits compared to people with diabetes and no detectable depression. But the good news is that preventative interventions for mental health can drive cost savings. So for every $1 invested yearly in prevention and intervention programs to support mental health, employers can save $2 to $4 on other expenses. And treating, or better yet, preventing underlying mental health conditions can drive lower medical spend overall. Next slide, please. So just like physical health, mental health exists on a continuum. Mental health is important whether we're thriving and doing well, surviving and just hanging in there, but probably could use more support to get back to a good place, or struggling and really in need of professional support. A person's state of mental health fluctuates over time in response to many factors, such as job stress, physical health, life events, environmental conditions, or our relationships. Traditional employee mental health benefits typically support employees who are struggling and require professional intervention, which could include EAPs, medication, or psychotherapy. However, there's a very large subset of employees who may not fall in the struggling category. In fact, this is by far the majority of your population, somewhere around 90 to 95% of it. But even though they don't have a clinical diagnosis, they're likely facing stressors and could benefit from additional support to help them stay on track. So CALM, we're not therapy, but we're definitely a tool that can support mental wellness across the full continuum. We can't benefit from mindful practices unless we use them. When mindfulness tools are readily available and easy to use, like within our app, they can be easily incorporated into our daily habits and really make a difference. And when you invest in a preventative solution like CALM, you not only help reduce stress and anxiety risk factors now, but you're preventing mental health conditions in the future and reducing downstream healthcare costs. Next slide, please. To help HR benefit leaders implement the holistic preventative approach that minimizes mental and whole body health risk factors, we've developed the Healthy Mind Workplace Model for Whole Health. It includes 5 key pillars of prevention for mental and whole body health. Next slide, please. So the 5 pillars you can see here are reduce stress, sleep well, regulate emotions, build social connection, and improve whole body care. I'll dive deeper into each pillar. Next slide, please. Our first pillar of prevention is reducing stress. Stress takes a toll on mental and our physical health, especially when it comes to work. In fact, a birth cohort study estimated that at age 32, 45% of incident cases of depression and anxiety in previously healthy young workers were attributable to job stress. Numerous studies have demonstrated that working conditions and job stressors are linked to mental health conditions and a whole host of health conditions like cardiovascular illnesses. In addition to depression, exposure to various job stressors has been associated with burnout, anxiety disorders, substance use disorder, and suicide, and other mental health conditions. Hence, preventing or reducing exposure to job stressors and improving the psychosocial quality of work could prevent a substantial proportion of common mental health problems. For example, providing CALM as a mental health tool to reduce stress can better support employee mental and physical health in the long term. Using evidence-based tools like meditations with grounding techniques, panic SOS, breathing exercises, and breathe bubbles, they all help a person in the moment and also help lower their chances of developing a clinical diagnosis later. Next slide, please. It's also important to help your employees reduce their personal stress wherever you can. Identity plays a huge role in mental health and personal stressors. For example, LGBTQ plus members are 2 times more likely than the heterosexual population to have a mental health disorder. And biracial individuals are more likely to report a mental health condition. So at CALM, we collaborate with diverse narrators to create culturally relevant content to help reduce stress. For example, we recently collaborated with Lama Rod Owens to create a coming out meditation series to support the LGBTQ plus community wherever they are in their coming out journey. And what I'm most proud of is that 42% of our CALM narrators are Black, Indigenous, and people of color. Next slide, please. So it's no surprise that a good night's sleep is a key pillar in a preventative mental health strategy. Quality sleep promotes brain plasticity, our brain's ability to be adaptable. Moreover, lack of quality sleep affects us physically and mentally, and is a very strong predictor of depression. Studies have shown that poor quality sleep and lack of sleep increases the risk of type 2 diabetes, elevated blood pressure, and other physical conditions as well. That's why CALM has an entire section of content devoted to sleeping well. CALM Tools helps promote sleep, including soundscapes, sleep stories for adults and kids, and our Sleep Better Masterclass. In a randomized trial of over 1,000 participants, on average across all employees within CALM, with CALM relative to those who didn't receive CALM, insomnia symptoms were reduced by 21%. Next slide, please. As humans, it's normal that we feel a continuum of emotions, and some, such as grief, anger, and anxiety, can be overwhelming. These negative emotions can lead to poor physical and mental health in the long term. So our third pillar of prevention is focusing on regulating emotions. Studies have shown that practicing mindfulness can help people learn how to regulate and cope with these challenging emotions. In fact, mindfulness is one of the most prevalent non-pharmacological approaches known to reduce stress and anxiety. It brings about various positive psychological effects, including increased subjective well-being, reduced psychological symptoms and emotional reactivity, and improves behavioral regulation. And a little goes a long way. Mindfulness or meditation interventions of only 5 to 10 minutes for 3 to 4 sessions a week can effectively buffer stress and anxiety. CALM provides meditations of different lengths, an in-app tracking device to monitor mood, and classes to help manage strong emotions. In the same RCT I mentioned earlier, on average across all employees with CALM relative to those who did not receive CALM, anxiety symptoms went down by 24%. Next slide, please. Most of us know that social interaction is a cornerstone of good health, as social connections generate positive feedback loops in our brains and bodies and promote physical, emotional, and social well-being. So our fourth pillar, building social connections, is an essential foundation for a healthy mind and body. We know that chronic loneliness is strongly associated with early mortality, but the quality and quantity of social relationships in our everyday lives affects our physical health, mental health, and mortality risk. The recent challenges of the remote workplace have only worsened social isolation and loneliness. In a 2021 survey from the American Psychiatric Association, roughly 65% of remote workers reported that they felt lonely and isolated at least sometimes. And in addition to the above health challenges, workplace loneliness specifically can have serious effects on organizations as a whole, because it can diminish the solidarity of an organization's members, which can be a huge problem, but especially in remote workforces. Further, loneliness, it reduces creativity, it erodes performance, and increases turnover in tension. So employees who experience high degrees of loneliness also grapple with considerable emotional exhaustion. In the new remote hybrid world of work, HR benefits leaders will want to innovate in new ways to build social connection and camaraderie in the workplace, enhancing whole body health as well as employee performance. CALM offers these mental health support tools to address emotional exhaustion from loneliness, build empathy, and develop strong relationships with others. Next slide, please. Our fifth and final pillar focuses on whole body care and is made up of several components. Eating well. Many studies have established a relationship between diet and mental health, with a poor diet being associated with our most common mental health conditions of depression and anxiety. Adequate nutrition is simply essential for countless aspects of brain functioning. Improving one's diet helps us across the board, and mental health is no exception. In a similar vein, staying or getting active helps us across the board as well. Aerobic exercise has been proven to reduce anxiety and depression. And of course, it's well known that physical activity helps reduce cardiovascular conditions, hypertension, cancer, other diseases. And last but not least, keeping up with preventative health screenings is critical. So CALM has a number of tools that helps you address whole body care, from walking meditations to daily movement and stretching exercises to our mindful eating masterclass. Next slide, please. And we're backed up by science. We have 26 published studies, and our most recent one, a randomized controlled trial, retail employees who were offered CALM had much better mental health and sleep outcomes over time than employees who didn't receive CALM or coaching. So a few takeaways from the study. On average, across all employees in the CALM intervention relative to waitlist, depressive symptoms were reduced by an estimated 25%. Similarly, anxiety symptoms were reduced by 24%, insomnia symptoms were reduced by 21%, and daytime sleepiness, that was reduced by 19%. And the most significant finding was that CALM reduced total absenteeism costs by an estimated $155 per week for each employee. That's a huge ROI achieved in just 8 weeks, not 8 months or 8 years. And with that, Rachel, I'd like to turn it over to you now to share how Cincinnati Children's provides a preventative approach to mental health and these key pillars of prevention. Thanks.
Great. Thank you so much, Chris. And thank you, everybody, for joining today. Again, my name is Rachel Greil. I'm an HR consultant with Cincinnati Children's Hospital. I work on our benefits team, and I oversee and run our employee well-being program. So I'm happy to be here today with you to share a little bit more about Cincinnati Children's approach to supporting employee mental and emotional well-being, as well as go into details about our partnership with CALM. Next slide, please. So before I go into the details around our approach to supporting our employees' emotional mental health, I want to provide some insights around who Cincinnati Children's is. I also want to give you just a little bit of pulse about our methodology when it comes to choosing vendor partners as well as meaningful programs for our employee population. So Cincinnati Children's is a nonprofit academic medical hospital comprised of over 17,000 employees. The majority of our population works at our main hospital located in Cincinnati, Ohio. Close to 80% of our workforce is female. We consist of 26 locations across Ohio, Kentucky, and Indiana. We have a diverse workforce comprising of those who work in patient service roles. So those would be like our nurses, our doctors, patient care advocates, social workers, psychologists, psychiatrists, and so on. Those in shared services, so that would be like many of us within human resources, IS, food services, patient services, management. We are a research institution, so we have researchers, we have surgeons, and we're also a teaching institution. So we have faculty as well as residents and fellows. Next slide. So our vision is to be the leader in improving child health, and our mission is to improve child health and transform delivery of care through fully integrated, globally recognized research, education, and innovation. Next slide. So we know that in order to deliver on our mission, vision, and aspirations, we need to attract and retain top talent through meaningful total rewards. Additionally, we need to make sure our workforce is able to thrive both inside and outside of the hospital. We want to make sure that our total reward offerings elevate our employees so that they can elevate our mission. We are very intentional in our approach to total reward offerings, making sure that we keep our guiding principles in the forefront of all of our decisions. Next slide. So being one of the top pediatric hospitals in the world, our staff care for some of the sickest of the sick kids. One thing that is also relatively unique about our population is that we are fully mission driven. Many of our employees see their work as more of a calling rather than a job. They are truly caregivers through and through. So even before the pandemic, we were seeing high prevalence in mental health conditions such as depression and claims data, and high levels of emotional drain in our employee survey data. We're also hearing from our employees that we needed to do more to support staff's emotional well-being. Next slide. So in reviewing how to better support our employees and their families' emotional and mental well-being, we identified gaps and opportunities. We realized that our current offerings didn't really cover the full spectrum of mental health. We offered free therapy sessions, but we didn't offer too much in terms of prevention or support for more subclinical conditions. We also recognized that although we offered free counseling through our employee assistance program, it was very hard for employees and their families to get access to see a therapist. Oftentimes, we just had very long waits. We wanted to make sure that any future programming that we put into place provided the right level of support for our employees and their family members, and that they could access this program and the resources when they needed it. Additionally, we need to make sure that we're providing a holistic approach to well-being. So based on the 5 prevention pillars that Chris outlined, here are some of the mental health programs we're doing in each of those areas. Next slide. So in order to better support our employees as well as their families, we started exploring different vendor partners who could provide easy access to different levels of care, provide preventive programming around building resiliency, reducing stress, as well as help with sleep. So one of the first things we did when providing better emotional and mental health support for our employees and our family members is to invest in a more robust employee assistance program solution. So the new vendor that we work with for employee assistance programming provides easier, quicker access to therapy as well as mental health coaching. They have an online mental health assessment that helps to recommend a care path for employees and their family members to follow. And all employees and their family members have unlimited access to care navigation so that those care navigators can help employees find the right level of care at the right time. In addition to providing a more robust employee assistance solution, we also partnered with CALM. Next slide. So in addition to kind of investing in new programming, we also wanted to keep promoting and utilizing the programs that we've had great success with. So we also provide guided reflections in our main chapel. This is led by one of our wonderful holistic health specialists. And we also have peer supporters to provide an extra level of emotional support for our clinical staff. With our new EAP provider, we also now provide in-house mental health clinicians to provide support for employees, departments, and managers. Next slide. So Chris mentioned before that you really need to take a holistic approach and view when it comes to mental health. Given our population, we are 80% female. Not only are we 80% female, a lot of us are of childbearing age. We're also a children's hospital, so you can imagine that we bring in a lot of people who have families or want to start families. So it's very important for us to invest in robust family support benefit offerings to help to alleviate some of the stresses that come from being a caretaker. So we know that, family well-being definitely goes hand in hand with emotional well-being. So when we look at family support benefits, we want to make sure that it's inclusive of all family types, as well as provides resources and support across the full caregiving continuum, from starting a family to raising an infant to taking care of an elementary school child, high school, college, to caring for your aging parents. We wanted to provide resources in all of those areas. So some of the benefits that we do offer to support family well-being are paid parental leave. So this would go beyond what employees would get through our short-term disability for maternity. And this actually is paid time off to bond with your child. And this would apply to anybody who recently has a new child. So that could be either through the birth of a child or through adoption. We also offer subsidized backup child care and subsidized backup adult care. We have a pretty robust lactation support program. We provide family planning supports through adoption and surrogacy reimbursements and fertility coverage. And the slide says infertility, but we really do provide fertility, again, keeping all family types in mind. We provide all employees and their dependents access to free behavioral consultations for families who are raising children with developmental or behavioral challenges. We have college coaching program for those who have high school students. They can talk with a college coach to help them through applying to college or filling out like a FAFSA application. And then additionally, with the new partnership with CALM, we now have even more support for children through their comprehensive library. Next slide. We also want to make sure that we are providing resources to support sleep. As Chris mentioned, sleep is a very important component to emotional health. So before we launched with CALM, we did offer some programming to help with sleep. We had free health coaching, and we still do, and this is available to our employees. Employees were able to have unlimited access to telephonic coaching to discuss strategies on incorporating better sleep hygiene into their lives and things like that. They also had access to online webinars. Through our partnership with CALM, we now have even more robust support for sleep. They have sleep stories, they have meditation and breathing practices to help you fall asleep and stay asleep, and this has been really well received from our employees. In fact, this is the number one thing that people state that they love about CALM through our employee feedback are their sleep stories. I love it personally because it kind of provides almost a safer entry into an app that can address emotional well-being. We all know that there can be a stigma around mental health, and oftentimes it's safer for people to talk about how they can't sleep or they're so tired, other than talking about they are feeling depressed or anxious. So the hope is that they go into CALM for their sleep stories or their movement exercises or their soundscapes, that they then will experience and be exposed to some of the other content around mindfulness and breathing and stress reduction techniques. Next slide. So Chris also discussed the importance of social connection. We know that building meaningful connections in the workplace is super important to overall well-being. Pre-pandemic, most of us spent the majority of our time with our colleagues. And depending on kind of your industry, a lot of our employees still continue to spend a lot of time with their colleagues. But, depending on like your work dynamics, some have also moved more to hybrid or remote working. But regardless, we want to make sure that you're connecting with one another. So ways that we encourage social connection is through building regular check-ins at the start of each meeting. So we encourage all leaders when they have a meeting to build in these check-ins. And what check-ins are, they're really just simple questions, such as like, how was your weekend? What is your favorite part of summer? What are you looking forward to most this year? And this can really help to spark conversation. It can help bring people into the moment and also help them understand each other a little bit better, maybe connect with each other a little bit more, maybe see your colleague as more as a human than, just a colleague. So it really has been well received. You can do it regardless of whether you're in person or virtually. I know within HR, a lot of us do spend a lot of time remote now. And so during our HR staff meetings, we always have a check-in question, and it's just presented on the screen, and people can use the chat feature to answer the questions. And oftentimes there'll be side conversations kind of going in like, oh, you love the beach. I love the beach too. Hilton Head's my favorite place to go. So it really kind of builds kind of a sense of camaraderie. We also have employee resource groups that are available for employees to join, where employees can really meet with others who work at the hospital from similar backgrounds. So some of our employee resource groups include resource groups for the LGBTQ plus community, veterans, African-American professionals, Hispanics, young professionals, and so on. And through those groups, they do a lot of community activities. They will have in-person events. They will have virtual events. So it is a really great way of bringing people together. We also want to kind of keep mental health in mind and continue our efforts on removing the stigma to mental health. So we really try to build in conversations around mental health and awareness of mental health conditions in our connection points. So for example, we are working on building out content and discussion guides for our managers on how to talk about mental health with their employees, how to recognize signs of burnout and emotional drain. If you recognize those signs, what to do. With our new EAP partner, we do have management consultations where managers can have discussions with counselors who can help them walk them through how best to have those conversations. So we will continue to promote things like CALM, as well as our EAP offerings to really keep that conversation going. Next slide. So Chris mentioned earlier in his presentation the importance of whole body care. So at Cincinnati Children's, we really do take a holistic approach to well-being, focusing on physical, emotional, financial, and family. And in order to help employees kind of connect the dots of how they're all interrelated, we've really branded all of these under one resource. We call it Living Your Best Resources, and we try to communicate them in a cohesive way. We oftentimes will promote benefits around different areas, around a centralized theme. So for example, in October, we will be communicating to employees Fall into Health. And through this, we're really going to provide information and resources around healthy body, healthy mind, healthy family, to really help employees become more aware of the resources that are available to support their whole well-being. Another way that we also kind of connect the dots is really through making sure that we have robust vendor integrations. So we always make sure to talk with our vendor partners, educating them about all of our resources so that when they are talking with our employees, they really are looking at their situations with a holistic lens. So for example, if an employee is working with one of our health coaches on nutrition, and then they're talking through eating habits, and it comes about that maybe a lot of their eating is contributing to high stress, that's when a coach might mention resources such as Calm on helping them reduce their stress, and some of the modules around healthy eating and mindful eating and things like that. So same with our care coaches. If an employee reaches out just because they're trying to find a place that cares for someone who has dementia, perhaps they're caring for their mother and their mom has dementia, their care coach, of course, will address the most urgent caregiving need, but they'll also remind employees to take care of themselves and the importance of self-care, and again, recommend other resources that could be available, whether that's in the community or offered through children to help support that individual. Next slide. So I've shared a little bit about how we incorporate Calm into supporting employee well-being and also our approach around supporting emotional and mental health needs of our employees. But now I'd like to take a moment to share more about our partnership with Calm. Next slide. As I mentioned in previous slides, we're really looking at providing a comprehensive approach to supporting the emotional well-being of our employees. We loved how Calm was already well-known in the marketplace and well-known with our employees. The Calm suite of services really aligned with our goals around emotional well-being support. As a bonus, they also had comprehensive support for children, so we could offer a programming that supports our employees' whole family. The implementation process was super easy. I've been in well-being for 13 years, so you can imagine implemented tons and tons of programs, and the implementation with Calm, I can say, is one of the easiest programs that I've ever implemented. Next slide. So in addition to being super easy implementation, it was such a huge satisfier with our employees. We immediately received positive feedback, and we've had really great utilization. So far, we have more than 3,600 employees who've signed up, and within those 3,600, we have an engagement percentage of 67%. We haven't even been with them for a year, so we really expect this to continue to grow as people gain more awareness about this program. Next slide. So again, we've had such great feedback, and we use this feedback to really highlight the value of Calm and promote it. So these are some quotes from some of our employees. The people in the circles are not our employees, but the quotes are. They're real. And so one of my favorite stories to share is that we had an employee who reached out and said how happy and grateful they were to us for offering this free subscription to Calm. They said not only do they use it, but their child uses it too. She said that she liked to use Calm and access to, because they can share their subscription with up to 5 devices, so you can share it with your family. And she said she used it as a way to really talk with her daughter about the importance of self-care. And so her daughter started using the sleep stories, really loved it, and then actually did a science fair project on are sleep apps truly effective, and used Calm as that example. So I thought that was just such a cool story. And I thought it really just spoke to our population, because we are a hospital, so of course we are going to try to promote self-care, especially with children. And then, a lot of us are very science-minded, so it makes sense that her child then would take it to a science fair. I thought that was a really cool story. All right, next slide. And that is all I have for you. So I'm going to turn it over for Q&A.
Thank you. And as a reminder, to ask a question, please use the Q&A panel located on the bottom right side of your screen. Please type your questions into the text field and hit send. Please keep the drop-down as all panelists. All right, we do have some questions here already. The first question, Chris, this one's for you. You mentioned mindfulness. Can you help regulate emotions and reduce stress? Can you explain why this is the case? What's going on in the brain, and why is this a good preventative intervention?
Sure. So I think if I understand the question correctly, what we're talking about is mindfulness and how that helps regulate our emotions, how it reduces stress in general and prevents. So when we think about mindfulness, right, people often confuse it with meditation. So first things first, mindfulness is super easy. It's paying attention to what you're doing right now. That's it. Nothing else on this globe matters. You're focus. That's mindfulness in a nutshell. Meditation is a practice where you're trying to clear your brain. There are many different aspects of meditation, different practices. It's a skill that takes time to develop. So I want to ground all of us into, we're talking about mindfulness right now. So the reason mindfulness is so wonderful for stress is that in preventing anxiety and preventing stress is that mindfulness is something that anybody can practice and essentially can do it very quickly and get instant relief. So the audio track we played today by Chibs, right, that's essentially helping people to just focus on one thing and being able to clear out the clutter by having a hyper focus on something. Kids can learn that, adults can learn that, and the reason it works so well for preventing stress is that if you think about what anxiety or stress is, and basically they're the same exact thing, stress and anxiety is when we're having lots of thoughts running through our head rapidly about the worst case scenario. Things that aren't actually happening right now, but could be happening. Probably won't, but could be, and they make us feel stressed. So what ends up happening is we're spending so much of our time and stress thinking about the future, not about here and now. So by practicing mindfulness, we're teaching our brains each time we do it a little bit more. Focus on the now, focus on the here. And chances are, if you're living in America and you're not undergoing significant hardship, chances are your life is pretty good and you're not experiencing something that would warrant a stress reaction. And when I say that, I'm saying that very academically. A stress reaction is great if you are fighting a bear. You need a lot of adrenaline to run away from it. A stress reaction doesn't help you at all if you are trying to be engaged in a meeting, if you are trying to help another human being, if you're driving the kids to school. Stress doesn't help you. It just annoys you. So when we are mindful, what ends up happening is that we get good at keeping our brain in the here and now, and we can do it over and over again in little tiny 1 minute, 30 seconds, maybe 5-minute intervals that builds up over time. So those microdoses of mindfulness really can be something that you can incorporate into your daily life that makes a huge difference in preventing stress and anxiety and makes you feel good while you're doing it too. So I think that answers it. It's a little long-winded, but I'll stop and wait for the next question.
Thank you so much, Chris. All right, our next question, this one's for you, Rachel. You mentioned sleep is a safe entry point for mental health support on Calm. How do you integrate Calm into your employees' daily life? How else do you break the mental health stigma?
Yeah, that's a great question. So I'll start by how we promote Calm and how we encourage employees to really kind of incorporate this into their daily lives. So one thing that we do is we do try to role model it here at Children's, like by incorporating it into workflows. So for example, if I'm doing a presentation or starting a meeting, I oftentimes will start with a brief meditation, similar to what we did at the start of this webinar. It's a really great way of introducing people to meditation, to mindfulness practices, and it's also a way of promoting Calm. Like, oh, okay, that was just an example from one of our newest benefit, Calm. Another way is through employee stories. So I know when I was having a webinar and introducing Calm to my HR colleagues, right away people were like, I love Calm. I love using their sleep stories. I love their soundscapes and things like that. So really by sharing stories of how other employees are using it will encourage them how they could use it. So we always try to remind them that, there are movement exercises, they have desk stretches that you could incorporate throughout your day. They do have soundscapes, they have focus music. So while you're working at your computer, you could put on some of that music to really calm you, just as background noise. You can incorporate breathing exercises into your day. So we really try to highlight all of their offerings, and they have so much that, people could really figure out a way to best fit it into their lives. When we talk about kind of how we are working towards removing the stigma, it's really just by education and awareness is where we're starting. So we worked with our EAP provider on developing content around, I think I mentioned this before, like discussion guides around talking about mental health with your teams, how to recognize signs of burnout, compassion fatigue, stress, how to have those conversations. We also will promote various webinars around different mental health topics, such as teen depression was one, talking about recognizing the signs, what to do if you do recognize any of these signs, how to get help, substance use, all of that. We're really just each month trying to highlight a different mental health topic so that we're always talking about it. And so that's one way that we're doing it, as well as, training our leaders and managers. But yeah, I hope that answered the question.
Great. Thank you, Rachel. I do believe so. Our next question, this one also is for you, Rachel. What is your calm utilization/engagement across your population?
Yeah, so one thing that is cool about Calm as a shout out is that you have access to their admin portal. So I have it pulled up right now, so I can give you the latest and greatest on it. So our utilization right now is 22.4%. So we have 3,693 employees that have signed up. And the engagement so far with those who are signed up is 67.9%. So pretty good engagement, I think. But of course, I always want to see it better.
Of course. All right, thank you. We have another question, and they're asking if they could watch the recording on replay at their leisure. And yes, the recording will be available, and you will get a follow-up email. And that does wrap up the Q&A session. Do you guys have any last-minute thoughts?
I want to thank everybody for today, and if there's anything that anybody needs to know, they can follow up with us at sales@calm.com, and really appreciate all of our time. And Rachel, I'll throw it to you for the very last word.
Yeah, so again, thank you guys for joining us today. If you do have any other questions for me, I'm always happy to talk with fellow colleagues and discuss, ways that we can better support our employees. So I just want to throw that out there. All right. Have a great one.
Perfect. Thank you, guys. This does conclude today's presentation. You can chat with Calm Business Specialist at sales@calm.com. And thank you, and have a great rest of your day.